Hello, everyone. I'm hoping that you are doing well and staying safe. So welcome to the NYU Returns webinar on returning to work for researchers. Please note that closed captioning is available for this session. And my name is Dee Dow. I'm a venture associate at the NYU Innovation Venture Fund. With me today are Stacy Bloom, Vice Provost of Research, Rich Baum, Chief of Staff to the President, and Carlos Ciatoli, Associate Vice President of NYU Student Health and Executive Director of the NYU Student Health Center. So thank you all for joining us today. We'll be starting off with a presentation, followed by some questions that were submitted in advance from our community. We'll also be taking questions from the audience. So if you have questions, please click the Q&A button and share that with us. We'd also like to remind you that we will only be answering questions returning to work for researchers today. So if anyone has asked questions outside of that, that would be better to be answered in future webinar sessions. And please know that we will pass those questions on to panelists in the future. Let's get started. We're going to begin with a presentation on returning to work with Rich Baum. Rich, I'll hand the mic over to you.
Thank you. We thought the way to start this was to just give a quick presentation to set a baseline of how we're thinking about the Returns project. As Dee said, my name is Rich Baum. I'm Chief of Staff to the University President, and I'm one of the people coordinating the various facets of NYU returning in the fall. And before I even go to the first slide, so I just have just a very few slides to illustrate some points. Before I start, though, I wanted to say that it's our view this project, this whole enterprise wouldn't work if it was simply a group of us coming up with some plans and then releasing them and asking everyone to follow some directions. There's just too many moving parts. It's too dynamic. People in the research area know how complicated their relationship with the university is, how many facets there are. So it has to be iterative and a kind of dialogue so that what the university does responds to the actual needs on the ground throughout the university. So we're doing this today both to answer your questions and to create a forum now and in the future for you to share your thoughts and raise concerns. And I'm not saying that simply out of altruism or a sense that concerns should be heard, but a sense that the way to make this work is to respond to what people are hearing and experiencing in their units. So if you go to the first slide, please, or the next slide. We all read a lot in the newspaper or all sorts of places about various forms of guidance about what should be done, how workplaces should be configured, how colleges should come together, what individuals should do. And we pay attention to as much of it as we can. I put these three up just to call out what we primarily look to, or at least look to first in orienting the university. The center rectangle there is the most famous, the one you've all heard of, the CDC. Obviously, the CDC isn't quite what it always was, but their guidance does ripple through American society, and it is meaningful and, I think well-founded. The most important illustration is originally, you'll remember, they were very focused on touching surfaces and then shifted to masks, which obviously had an enormous impact. And even very recently, they released guidance for higher ed, which we look at carefully and the state looks at carefully and matters to us in our thinking. On the left-hand side, probably most of you haven't heard of, the Commission on Independent Colleges and Universities. That's our professional association. It's sort of all the colleges and universities in New York, from NYU at the largest to very small institutions. It's our primary interlocutor with the state of New York in terms of how we give feedback to the state in terms of its direction. And it's also an amazing resource to us for kind of crowdsourcing our solutions. We're able to get on the phone and find out how institutions all over the state are dealing with the issues we're dealing with, and sort of test our solutions against theirs and see what they're thinking. It's a collaborative, non-competitive environment and a way to make sure to match our thinking to others. And on the right-hand side, of course, we know New York State, and New York State's exerted as you know, more control over day-to-day life in the state than ever in our lifetime, particularly with regard to higher ed. They've released very specific guidance to us about reopening. Some of it is in the form of directives, and some of it is in the form of best practices. We were required to write a submission to the state responding to the guidance about how we would follow it. And we filed that actually on Friday, and it's on our website now, I believe. And aside from that filing, the state guidance, we believe the state's been responsible and sort of careful in its direction, and it's really the bedrock of how we're orienting the university moving forward. If you can move to the next slide, please. These are the 4 areas of the state guidance, just to sort of mention them here. They asked us to respond to their directions and best practices on reopening, monitoring, containment, and shutdown plans, which even in the most extreme circumstance, we wouldn't call shutdown. We'd call it a change in modality, because we would shift to online. We wouldn't simply shut down instruction. Like I said, we released an extensive report on this, and all of this is online for you to review. Next slide, please. So when we started this project a while back now, we all sat down just to think about how we would think about our guiding principles. It's very easy, as I've learned, to get absorbed into very minute issues, but lose sight of their wider impact and how they fit into the bigger picture. So President Hamilton, Provost Fleming, the deans, some of us on this call sort of tried to figure out, okay, what are the main kind of goals and objectives? And I don't want to dwell on them at length here. I want to get to your questions, but just to call them out. The first is create layers of safety, and I'll get to that really in the next slide. The idea being that there's no one solution, there's multiple solutions to create a safe environment. 2, maintain the highest possible standards of teaching and research. I think we all aspire to a level of excellence here in teaching and research, and we didn't want to just decide because so much was changing that we would settle for whatever's passable, that we wanted to work on the assumption we have to make it as great as it can be. 3rd, rely on multiple modes of teaching, learning, research, and working. In other words, have a sort of interlocking system of distance learning and distance teaching and live learning. 4, be able to respond flexibly and quickly to evolving public health landscape. We've seen that just in the last few weeks when the level of COVID, the outbreak around the country spread to various states, and our own state required a 2-week quarantine for those coming from those states. We've had to dramatically change our housing plans to accommodate students who would quarantine when they return. But I can almost guarantee there'll be other curveballs in the coming months. It's just the situation's too complicated to assume we can make a plan and just stick to it without changing it. Next one, create a flexible fall, spring, summer schedule. In other words, allow maximum flexibility among everyone here to decide how to space out their research and learning. The second to last, not consider the global sites drag, but use them as an asset. There are, as I'm sure you all know, many students at NYU who can't enter the country now, and this is one of the, if not the most international campus in the US. And we've utilized the sites as a way for them to gather and continue their advancement from those sites. And the last item, advance equity, diversity, inclusion, and belonging, and enhance pathways of success for marginalized and or vulnerable members of the community. We've all seen and read about the disparate impact of COVID across the country, and it's very important to us that NYU not replicate that within NYU, and in fact do what it can to offset that in the external world. This takes the shape of a lot of different things, ranging from providing laptops to people who need them, to internet access, to how we handle the cost of housing, all to make sure that communities that are face various challenges, that doesn't create a situation where they're totally marginalized by this situation, or marginalized at all by this situation. Next slide, please. These are I just put this up to sort of identify, these are the 6 areas that we organize this in. All our lists, everything we need to do, we fit into these, and we have administrators working in each of these to make sure that we don't lose track of any of our major needs. Next slide, please. So this is where we are now. I'm sure you're familiar with these: masks, teleworking, and social distancing. And obviously these are major requirements throughout society. But the next slide is a list of what I called before the layers of safety. And all that means is anyone who tells you there's one solution, you have to do X, doesn't really understand how this works. There are a lot of strategies. Each one reduces the level of risk, and together they reduce it to an acceptable level. And testing is one of the most important, but it's also tracing, quarantining, face coverings, distancing, daily check-ins, dedensifying and cleaning, and then more. The big project that Dr. Ciatoli and others work on here, and I work on, is making sure that all these layers of safety are implemented, work well together, and are clearly explained to the community. Next slide. So this is the public health campaign. If you're on campus now, you're starting to see this around campus, and in the coming weeks, it should be ubiquitous. The point of this is that, one of the mistakes throughout the country is dealing with COVID became something you just do to keep yourself safe. And particularly for young people, that wasn't very persuasive, partially because they often feel invulnerable just by nature, and part of it is they felt that they weren't affected. They couldn't be affected by the illness, although they're wrong about that. But we just felt that within NYU, the way to present this was what you're doing for others, not just yourself. It's keeping each other safe. It's your friends, it's your professors, it's the public safety officers, it's the wider New York community. And we're trying to press that pretty hard. And you'll see not just the posters, but a major kind of public affairs campaign of our communications office continuously through the semester to make sure that people have this forefront in their mind and understand, as you see in the right-hand graphic there, what specific form this takes. So with that, I'm going to pass off to Dr. Ciatoli to talk about the specifics of public health and try and answer some of the questions that came in before this call started.
Great, and if we could go to the next slide. And thank you, Rich, and thank you everyone for the opportunity to come and share a little bit about what we are doing. So Rich alluded in the prior slide to the communications campaign that talks about the behaviors that each of us can really display and adhere to that are considered public health best practices. And if we go back and think about March and April, when New York was the epicenter of the pandemic, and where we are today, one of a handful of states that has low transmission rates, that have stayed low, it really relied on a few key health behaviors. That includes wearing a mask or face covering. It included distancing of at least 6 feet, washing your hands frequently, staying home if you're sick, and avoiding gatherings, being around large numbers of people. And those were really the interventions that we had available to us that got us to that place we were back in the spring until now, real adherence to that. And I think it's important that we continue that and really let that be the foundational part of our plan to keep each other safe. With that said, there are things that we're doing to facilitate social distancing. And that's everything from the reduction of the number of students in a class, to policy around gatherings, to signage, to facilitate distancing, being conscious of ingress and egress of buildings, all of which facilitate allowing us to maintain the appropriate physical distancing while we are back on campus. There's other things that we've done specific to NYU to reduce the risk of transmission, exposure, and spread, including the daily screener. Many of you who, if you've been back now for several months, have been each day, whether it's on the mobile app or the web-based version, going in and checking off whether you've had any symptoms consistent with COVID, whether you've been in contact with anyone, whether you yourself have been diagnosed. Again, a way of providing some screening, identifying people early, and frankly, re-educating people each day about the symptoms of COVID, so people remain that sort of vigilance. The screener also asks that you take your temperature each day and record that you haven't had a fever. Certainly there have been lots of questions around testing as we have gotten closer to the start of the semester, and we have put forth some requirements around testing. So for faculty and staff, the requirements are fairly straightforward. If you have been coming on campus into buildings, or you plan to before August 14th, we ask that everyone get tested prior to the 14th with your results back. There are multiple ways of doing that. While Langone is one option, it is not the only option. We're also trying to identify some sites, testing sites that have quicker turnarounds. I know people have been anxious because many of the urgent care centers or pharmacies that are offering testing are quoting 10 to 14 days for turnaround time. But again, we are aware of sites that are turning testing around quicker than that. So again, whether it's through Langone or other sites, people need to get tested and have results back by the 14th. Again, if you've been coming or plan to come during the rest of this week. If you're planning to come after the 15th or later, then you need to get a test no more than 14 days before your anticipated first day back into a university building, back on campus. Testing is obviously important to make sure that no one's coming back with asymptomatic illness. Obviously, if you're sick, we want you to stay home, but we know that a certain percent of people are asymptomatic. So again, it's important that people do get tested as part of this gateway testing back. When we test people, obviously, if they're positive, we want to isolate and have them away from everyone. And that would be something that you would discuss with your clinician, your provider, as to how long you need to be out for. It's also important for us to then do contact tracing. I know there have been a number of questions about what happens to the lab if we identify someone who's working in the lab tests positive. So we, as part of our COVID-19 prevention and response team, have a group of people who will do contact tracing. We are doing it collaboratively with the city's contact tracing program. We feel that having a better sense of the university through our own contact tracing team will facilitate and expedite contact tracing. If we identify any individuals who we feel are close contacts of a positive case, we will then ask them to quarantine for 14 days. Now, it is not an automatic that if someone in the lab tests positive, that the entire lab needs to shut down for 2 weeks. It's possible, but again, that would be a determination made through contact tracing, through conversations. And again, should we come to that, that is how that would play out. We will certainly continue to, as we've been doing, with tracking of metrics. So we will certainly follow state metrics, city metrics, as well as our own internal NYU metrics of case counts, test positivity, how many isolation beds we have in our residence halls for our residential students, how many people are failing the daily screener and reporting symptoms, among a set of metrics that we will track over time that will help guide both how restrictive we need to be or how we can relax certain restrictions if case counts and transmission looks like it's staying low throughout the semester. As we think about student health and how we're delivering care, we know, one, that some students won't physically be on campus, so we want to be supportive of them. In the spring, when everyone left somewhat quickly, we quickly reverted to a telehealth model, which we will largely continue in the fall semester. One, again, to be able to support many of our students who are not here, but two, it also helps protect students, our own health center staff, and others who might be in the buildings that we use for student health to minimize symptomatic people being in the buildings. So again, really thinking about how we transform the service delivery model for our students. So that is a quick overview of some of the interventions that we've got planned, some of which have already been implemented and some will be as we move towards the start of the semester.
All right. Thank you, Dr. Ciatoli. We're going to open up for questions to our panelists right now. And I have a question. We received a question around COVID testing for researchers returning to work, Dr. Ciatoli. So one of the questions is, do we need to be tested if we've already been working on campus?
So the answer is yes. I know that when we reopened the labs back in early June, we had recommended for people to go to get tested, and many did, and we were appreciative of that. But obviously, time has passed, so we are asking that anyone who was tested before August 1st get retested with the sort of parameters that I had outlined a little bit earlier and was in the emails that everyone has recently received.
Great, thank you. Another question around COVID-19 testing that for you is, do we need to be, if individuals have remained in the tri-state area, will they need to get tested? And what if they're coming from out of state?
So we have not made a distinction for faculty and staff from tri-state or not tri-state. So it is the same testing requirement for both groups, whether they're from the tri-state or if they've spent any time out of the tri-state area.
Great, thank you. These next two questions, I heard you covered it during your presentation, but since it was submitted, I'd just like to ask it anyway. So I think a lot on people's mind is, where can we go to get tested, and how far in advance should we get tested? And given that these are dates, might you just answer that question again quickly for everyone?
Sure. So for those who have been already back in the lab, we are asking everyone to get tested again with the results back by August 14th, so the end of this week. For those who are coming back after Friday, the 15th or later, no more than 14 days before their anticipated date back in a building, in the lab, or whatever building they're coming back to. And again, multiple testing options, Langone being one of them. For those that were already here, we had provided a phone number. For those who are coming back later, after this week, we provided Langone with a list of all employees, and they will actually message out to everyone that they can access their MyChart, how to download the MyChart app and actually make an appointment through that, or they will actually have an order waiting for them to make an appointment. So that's Langone. If they want to go somewhere else, that's fine too. And again, I think while we have provided links to a broad set of testing sites, we know there's been some variability in turnaround time. So we're trying to identify a handful where we know turnaround times are a little bit quicker, so people can get their test results back in a matter of days rather than weeks, which is what we're hearing from some sites. And we can push those out. They change a bit, but we will try to circulate those through as well if people want to access options other than Langone.
Great, thank you. And then this other question is around quarantining, which you also spoke to in your slide. So suppose that someone in a research lab or group tests positive for COVID-19. What is the guidance on next step? And who will make the decision if a group needs to be quarantined, and how will that decision be communicated?
So as I said before, we'll have our own internal contact tracing team as part of our university COVID-19 prevention and response team. We will work certainly collaborative with the city's contact tracing team as well. And should there be need to quarantine either any individuals or the entire lab for that matter, should it come to that, our COVID-19 prevention and response team would be reaching out again to the individual or the entire lab for quarantine instructions.
Great, thank you. Another question that we received, I think Stacy, would be directed to you around questions about PPE protocols. So what is the protocol for PPE and social distancing for in-person research? And what is the justification for the protocol?
Yeah, thank
Stacy?
you. Hi, everybody. Thank you so much for submitting these questions around research. And I also just want to take a moment to thank all of you who are involved in NYU's research enterprise for your incredibly hard work during this time. We've managed to maintain a very robust set of research activities all throughout the pandemic. with work on a broad range of topics that has really led to public health, advances in public health and public awareness. And we're just very, very, very grateful for the strength of our research enterprise and just how resilient and perseverant you all have been during this time. So whether you're a researcher or a person who supports research, we are so, so grateful for all of your efforts. For PPE and social distancing guidelines in the lab, these followed the state and CDC recommendations for PPE and social distancing that are no different from what we're seeing in terms of other regulations at the university. And they're spelled out a little bit more clearly depending upon your research activity in the research reconstitution plan. It would be helpful, Monique, if you're able to post the link to that plan in the chat for everybody to click on if they need to refer back to it.
Great, thanks, Stacey. The next question we received were around NYU graduate student employee approved to work remotely. So the question is, what are NYU policies for NYU graduate students that are employed by NYU in New York and authorized to work remotely, but are currently not in the US?
Yeah, so thank you for this question. This has been a question that's been on our mind in the provost's office most of the past week. And I do expect that we'll have more formal guidance on exactly these issues in the coming days. I know that we've been working hard to prepare something concrete for you all to use. And of course, we are aware that we've got graduate employees who are either not in the US due to some visa issues or personal reasons, or they're also potentially outside of the tri-state area. So this raises a lot of issues, and it really depends on the country or the state where the person is. There are tax and economic implications that vary by country and by location, but there's also a lot of variability depending on NYU's status as an employer in these different locations. So the advice that we have for now is to confer with your HR unit, the head of your school or your unit, to start having discussions around this and to await more formal instructions that will come from the graduate deans and directors in the coming days. I hope that's sufficient for now.
Thank you. And on a related matters, what are the guidelines for NYU graduate students approved to work remotely and not living in the tri-state area? They're in the US, but not living in the tri-state area.
Yeah, thanks. So I was trying to include that in the answer that I gave in terms of graduate students who are potentially not even in the United States. There's the same amount of variability if you're beyond the tri-state area in terms of NYU's status as an employer in those areas and the tax and economic implications for your employment and your salary in those areas. And I think it's also important to understand this differentiation between the sponsoring agency authorizing your remote work. So it's possible that you have a grant from the National Science Foundation and your program officer has told you that it's okay for you to work in, you know, X, Y, or Z location. It's still important to work with your HR unit head because the NYU rules are going to trump those that the sponsor guidelines perhaps determine. So again, I would say go to your HR unit and start having a conversation about that sort of remote work, especially for your graduate employee population.
Great, thank you. And then Stacey, we have another question, but this is moving on to the human subject protocols. So the question is, when we first went remote, we were allowed to adjust human subject protocols to adhere to remote criteria like data collection and survey. Now, can we bring back face-to-face human subject work?
Thank you. Yeah, this is one of the biggest questions that we've gotten in the past few weeks. So since we've entered phase 3 of our research reconstitution plan, we are allowed to resume face-to-face in-person research. So in many cases, the protocols that were previously approved by the IRB are going to have to be tweaked a little bit to really call out what risk mitigation strategies are going to be employed in the face-to-face human subject research protocols. We've got a reactivation survey. That's an online form that we've created started, where if you are a researcher with a human subjects approved IRB protocol, you can go into this form. And again, we can paste that in the chat. And you can get, we're trying to expedite these as quickly as they come in, so they get IRB review really, really fast, to get a thumbs up or a thumbs down about whether or not you can resume. If you're turned down for resuming your study, the IRB will work with you to try to modify the study so that it does fall into the parameters for safety that we're looking for, because our goal is the same as yours, and that is to get our research enterprise back up and running as safely and as robustly as possible.
Great, thank you. Another question for you, Stacy, is as classes will also be held online in the fall, we received a question about audio enhancements. The question is, what audio enhancement will be provided to faculty to help students with hearing?
So thanks for this question also. This is certainly not my area of expertise, but this has also been a discussion in the provost's office. And my understanding is that there are different solutions for these issues depending upon the discipline and depending upon the school. So a lot of the schools I know are already testing some different kinds of microphones and these different amplifiers to improve audio in different classrooms where in-person instruction is happening. And I think the idea is to test as many of these potential solutions as possible, figure out what's working best for people, and kind of do more of that. I know that they are installing some individual mics in some of the classrooms and adding additional amplification systems in different locations now.
Thank you. Rich, we have a question about ventilation systems. The question is, how are we improving ventilation systems to reduce risk of exposure to the coronavirus?
So the issue, as I've learned it, I should start by saying I'm not an engineer or an expert in ventilation, but the issue, as I've learned, is the circulation of external air, bringing in air from the outside so that the air doesn't stagnate. The NYU, the office that's responsible for the Department of Facilities Management, has been working to modify and upgrade our systems to facilitate greater circulation of outside air. I'll just admit I'm going to read from my notes for a moment. This means increasing outdoor air ventilation during low occupancy hours, disabling what's called, and some of these terms, the demand control ventilation in all locations that have it. In other words, to allow continuous circulation of air, not to turn it off. They're opening the minimum outside air dampers to the extent possible to minimize the recirculation of air. And they're upgrading all the air system filters in the few places, and we're upgrading all to CDC standards. In the few places where there was a difficulty in doing that, they've installed HEPA filters as a substitute, essentially. So, we understand the concern. We've definitely heard the concern from many people, but we feel like our systems have been set up to permit adequate circulation of air. Carlo, do you have anything you want to add to that?
I would just add that I think as epidemiologists have looked at some of the indoor spread, particularly some of the sort of super spreader events, I think they've begun to identify what they call the 3 Vs, venue, vocalization, and ventilation. So back to our layers of safety, ventilation is one piece of what increases risk of spread or poor ventilation. And I think what we've done is, again, trying to address all 3 of those layers of safety. As it relates to venue, the risk is really crowded indoor spaces. So we've done everything we have done possible to reduce that in the classroom and in other spaces. In terms of vocalization, wearing masks all the time, again, dramatically mitigates risk, we know. And then to your point, all the things that have been done around ventilation. So collectively really reducing, I think, risk in the indoor spaces significantly.
All right, thank you, Dr. Ciotoli and Rich. Another question for you, Rich, is around health equity. What is this group doing to ensure that we don't exacerbate disparate impact on the most vulnerable communities within NYU?
So, as I mentioned at the beginning, this has been an important topic from the start of all of this. Some of you might know Lisa Coleman, who is the Chief Diversity Officer at NYU, and at the start of this created a document, an internal document that kind of talked through and helped people conceptualize the different ways disparate impact can occur. And she's been part of the whole restart effort. I showed you those 6 work streams. She and her staff are placed as advisors in each of those work streams, and the documents that she gave us were given to all the heads of the work streams to kind of review and talk through with the advisors on it. So there's no one way. An example is when we dispersed in the spring, we faced the issue that some students didn't have adequate technology to participate in their classes. So we gave them laptops to continue, and some also were in places that don't have broadband access. So we gave them hotspots and also tried to connect them with internet services that in their area. We've maintained, as students came back, low-cost housing options. It's a long list. It affects almost every area, but we've tried to keep it foremost that thinking through how each decision and policy would affect vulnerable populations.
Thank you for that answer, Rich. And the last question that was pre-submitted to us, I'll direct it to you, Stacy. We have a question about sick leave. If I get COVID-19, do I have to use my sick days and draw down on my sick leave allocated hours?
So this is another HR related issue, but it's my understanding that any employee with a confirmed case of COVID-19 does not have to draw from their sick leave banks when they're taking time off to recuperate.
Okay, thank you, Stacy. We have, I'm going to take questions from our webinar attendees right now. And the first question is, and this is to Dr. Ciatoli. What is the current policy for in-person research that follows all the state guidelines but does not allow for social distancing?
So we know that there are some situations where people may be, there may be a need to be within 6 feet of each other. And what we have done as policy is actually exceeded what the state has asked of us. The state says where you can't physically distance, wear a face covering. We've made a universal policy that people wear face coverings. So that certainly addresses the state guideline aspect of it. And then where those situations occur, we've been encouraging people to obviously minimize the amount of time that they are closer than 6 feet. Obviously, the longer that they have to be in closer proximity, the risk gradually goes up. But again, between the masks and trying to minimize that time, we are fully aligned with what the state guidance says, and certainly reasonable public health practice, again, with the wearing of the masks.
Thank you. The next question coming in from our attendees is, I think, Stacy, the question is, some researchers, faculty sit in open cubicles within 2 to 3 feet of another. Will this be changed or amended?
Yeah, so, Carlo's answer to the previous question is not irrelevant here as well. However, what we're really recommending for the research community is to really only be on site when you must be on site. If you can do your work remotely, if you can do your data analysis remotely, if you could write your grants remotely, we're highly encouraging you to do so. I mean, obviously a situation where there's, a bunch of people sitting in close proximity to each other for long periods of time is something we are pretty desperate to avoid. So I would say, to try to work on rotating schedules, which is what a lot of the active labs are doing, to try to maximize distance between individuals. I know that some people are physically removing furniture or taping it off, or reserving sit spaces for certain periods of time so that they can avoid a situation like that. I know that there's going to also be an online system that will allow people to find sit space that is safe and is socially distant. And I would say as much as we can utilize that, that is helpful as well.
Thank you, Stacy. That's all we have time for, and also we're not getting any additional questions. But I'd like to ask our speakers if they have any final thoughts they would like to share with the group.
I just want to
Stacy,
echo.
we'll start with. Sorry,
Yeah.
go ahead, Rich.
But
Please.
Stacy, I just want to echo what Stacy said and thank everyone for everything they're doing, and both to continue your research and just to adapt to the current situation. And we're very conscious that this is an incredibly difficult situation and requires more flexibility than many of us are used to in the workplace. So just thank you. Thank you for everything. Stacy?
Yeah, I echo that, and also just really want to thank Carlo and Rich. For people who are not familiar with them, they have worked so hard and so much. I think the two of them have been on every call and every meeting and every debrief, tirelessly working to make a safe NYU for all of us. And so we should all be very, very grateful for their immense contributions. And thank you, Dee, for moderating the discussion, and to everyone in the President's office for helping to organize it.
And Carlo, would you like to add any final thoughts to share with the group?
Certainly, I think, you know, as the governor often talks about, the success of New York was because of each individual New Yorker doing what they were supposed to do, were asked to do. I think that will be the success of NYU as we head into the semester. I think it's clear that the type of things that we need to do to keep each other safe, and, you know, optimistic about a wonderful fall semester.
Thank you. I'd like to take this time to thank Stacy, Rich, and Carlo for joining us today. And thank you all for logging on and participating in this webinar. This webinar will be posted on the NYU Returns website so that everyone, so anyone who missed it can view it. When you go to the NYU Return website, I encourage you to take a moment to check out previous webinars that have already been posted. And please continue to check NYU Returns for the most up-to-date information about the fall 2020 semester. And everyone stay safe and enjoy the rest of your summer.
Thank you.